All right. So the question, we're gonna demonstrate how to use ChatGPT real quick. GPT4. So the question, I just want to make sure I get this right here. All right. So we're gonna ask it, it being the AI, and it's been trained all sorts of different ways. It's a little complicated to explain exactly what GPT-4 is, but essentially it's a tool that's been trained on large language model and natural, all sorts of stuff. So that's best example is just to show you. So I'm going to ask it to act as a psychiatric mental health nurse practitioner in a full practice state like Colorado. What would be the most appropriate antipsychotic and dosing for a patient with renal and hepatic dysfunction? Let's see. Alright, patients with, alright. And we're gonna tell it to go ahead. So it'll start off with a disclaimer saying that it is not a mental health or a healthcare provider, so you should definitely research. Don't just believe what it says. But here is its response. In a case like this, renal and hepatic dysfunction significantly complicate choices, and so here's the choices that it's listing off. Whether or not these make any sense, I'd really love to hear from our psych NPs as to do these options make sense. And it took just a moment, right, to ask it the question and then for the response to come back. In general, let's see, lower starting dose is often recommended. Titration should be slow and cautious. Monitoring different levels, different labs, interdisciplinary team. Cool. And it knows that I am very interested in data analytics. So let's see, but it didn't actually give us a dose, a starting dose. So let's see what happens if we ask it to give us a starting dose. Provide a starting dose for each of the items. Oh boy. So now it's going to list off starting doses. Again, I am a operations administrator. I am not a prescriber, so I have no idea if these are within the realm of possibility on a starting dose for these medications based on the scenario provided. However, it did give me a lot of data and it seems legit. Now this is where things get a little tricky. Just because it seems legit doesn't mean that you should just go ahead and believe it, right? So one of the things I'd love to see is, can we compare this to the stall manual? What does stall say on these things? And let's do one level deeper. Provide risk factors. Actually, provide top 2 risk factors for each medication. Okay. So here's the risk factors. I am curious if it gave us, are there any contraindications? Sort of, because it's telling us about some of the things we should be watching for. And I'll post this entire feed here on a document just to see if y'all could critique it. Are there any contraindications? Oh, absolutely, Juan. Contraindications can be a big deal. So looks like haloperidol, risk factor or contraindication is Parkinson's disease, hypersensitivity, dementia-related psychosis. So again, oh, look at that. That is a very particular thing. No? Well, let's see. All right, last one, I swear. Maybe. Let me grab that and ask it something a little bit deeper about this medication and why it's a contraindication. Please expand on why those inhibitors are affected. Okay, so of course the information should have some vetting, of course, but how quickly, how succinctly, how fast did we get to all of this information? It's a phenomenal thing, and it's changing everything right now as we speak. So if you haven't tinkered with GPT4 or GPT 3.5, GPT4 is the latest version of ChatGPT, so it's through OpenAI, and you see the information up here. So anyhow, I'll post this in just a minute, but in less than 7 minutes we got into some really deep stuff about the question regarding prescribing. All right, and the use of GPT-4. All right, curious to hear y'all's comments.